So hello everyone, our today's topic is the anterior triangle of the neck. The anterior triangle of the neck, it is the one of the divisions that is used to describe the neck region. It is formed by borders of certain muscles and the bones. So the anterior triangle, it is subdivided into submental triangle, submandibular triangle, carotid triangle and the muscular triangle. So the triangles of the neck is quadrilateral in shape. It has anteriorly the midline of the neck, posteriorly the anterior border of the trapezius muscle, superiorly the inferior border of the mandible, and inferiorly there is clavicle. So it is the sternocleidomastoid muscle that divides the quadrilateral area into two triangles. One is the anterior region and other is the posterior region. So this sternocleidomastoid, this one is the sternocleidomastoid muscle. It divides. So this one is the sternocleidomastoid muscle. It divides the quadrilateral area into the anterior region is the anterior triangle and the posterior region is the posterior triangle. So we shall be discussing about the anterior triangle today. So the anterior triangle here, as seen in the figure, it is subdivided into submental triangle, this one, submandibular triangle, this one in green, carotid triangle, this one, and the muscular triangle, this one. So what are the boundaries of the anterior triangle of the neck? Anteriorly there is midline of the neck. Posteriorly you can see is the anterior border of the sternocleidomastoid muscle. The lower border, superiorly there is the anterior border, superiorly there is lower border of the mandible. That forms the base. And the anterior triangle, it is further subdivided into smaller triangles like the submental triangle, submandibular triangle, carotid triangle and the muscular triangle. So each containing various structures like the muscles, blood vessels, nerves, etc. So first triangle is the submental triangle. So three are paired and one is unpaired. The submental triangle, it is unpaired. This one. And the paired triangles are the submandibular, carotid and the muscular triangle. So first is the submental triangle. So this one is the submental triangle. Anteriorly there is midline of neck. Posteriorly there is anterior belly of the digastric muscle. So this one is the anterior belly of the digastric muscle. The base, it is formed by the body of the hyoid bone and floor, it is formed by the mylohyoid muscle. Now what are the contents? The contents of the submental triangle. So there are 2 to 4 small submental lymph nodes. So in the skin superficial layer between the digastric muscles. So remember, these submental nodes will drain into skin, the central part of the lower lip, the gums that are next to teeth, and the front part of the mouth floor, and the tip of the tongue. The tip of the tongue, their outputs go to the submandibular nodes. So small submental veins combine to create anterior jugular vein. Now let us discuss from the clinical point of view. Suppose a patient symptoms suggest there is location of lump, a potential issue within the submental triangle of the neck. So what could be the possible explanation that should be considered in that case? Number one, you can diagnose it as submental abscess. Abscess is a localized collection of pus that is caused by the infection. So if the infection occur in the submental triangle, what could you will see a formation of painful lump. There will be discomfort while moving the tongue, speaking and swallowing due to the pressure and inflammation that is caused by the abscess. So the abscess in this area will restrict the movement of which muscle? It is the mylohyoid muscle. That can lead to the following symptoms. The second, there could be submental lymphadenitis. Lymphadenitis means there is inflammation of lymph nodes due to infection. So enlarged and inflamed lymph nodes in the submental region could result in pain and discomfort. So if the lymph node press against nearby structure, including the mylohyoid muscle, so that will again cause difficulty in the tongue movement, speaking and swallowing. The third reason could be there could be tumor, submental mass or tumor. A tumor originating from structure within the submental triangle, such as sublingual salivary gland, could lead to similar symptoms. So given since the patient there will be on the basis of the patient symptom and their potential impact on their ability to speak, swallow and move the tongue, it is crucial for the patient to undergo an examination by a healthcare provider. The CT scan could be necessary to assess the nature of lump and its relation to the surrounding structures. The treatment could be given that includes antibiotic, drainage of pus, etc. Another problem that could be seen in the submental region is suppose a patient presents with a painless swelling in the midline, just below the chin. The swelling, it has been present for several months and that gradually increases in the size. The patient history includes history of dental procedure in the past. The patient, it is concerned about the appearance of swelling and growth over the time. So the patient symptoms and the location of the painless swelling suggest a potential issue within the submental triangle of the neck. So what could be the possible explanation that could be considered here? Number one, there could be thyroglossal duct cyst. A patient history of dental procedure might be unrelated to swelling. A thyroglossal duct cyst, it is a congenital anomaly that occurs when the remnants of the thyroglossal duct persist to form a fluid-filled cyst. So this cyst is generally present in the midline of the neck, just below the hyoid bone, and it is usually painless and enlarge over time. Other reason could be the sublingual dermoid cyst. So these cysts may include skin, hair and even teeth. A sublingual dermoid cyst may be present as swelling below the chin and could be painless. The third one could be the submental lymphadenopathy. The patient described the swelling it as painless and worth considering the possibility of enlarged lymph node in the submental region. So the lymph adenopathy, it can occur due to various reasons including infections or the inflammatory conditions. The next is the digastric triangle. The digastric triangle, it is also known as the submandibular triangle. So what are the boundaries of submandibular triangle? Anteriorly you can see is the anterior belly of the digastric. This one is the anterior belly of digastric. Posteriorly you will see the posterior belly of digastric. Superiorly it is surrounded by the inferior border of the mandible, and floor is formed by the mylohyoid muscle. So this layer, this region is the submandibular triangle. Now what are the contents of this digastric triangle? First of all, it contains the submandibular salivary glands. This major salivary glands, it is responsible for producing saliva that helps in the process of digestion. The nerves which are associated are the marginal mandibular branch of the facial nerve. So which nerve is associated? It's the marginal mandibular branch of the facial nerve to the mylohyoid and hypoglossal nerve. Hypoglossal nerve, mylohyoid nerve and marginal mandibular nerve. The artery associated are the facial artery. Facial artery is a branch of external carotid artery. The facial artery supplies the blood to the muscle of face and various structure in the submandibular and facial region. Lingual artery, deep lingual artery. A branch of lingual artery provides blood supply to tongue and the adjacent structure. Hypoglossal nerve, the arteries are the facial and the lingual arteries and the veins. The other structures are the submandibular gland, lower pole of the parotid gland and the lymph nodes. So what are the layers associated? Superficial structure contains platysma, facial vein, marginal mandibular branch of the facial nerve. So when you remove the superficial layer, you will be able to see the submandibular gland. So this one is the submandibular gland. The are the facial artery, lingual nerve, lingual artery, hypoglossal nerve. These are the remaining structures. Now now let us discuss the applied anatomy. Suppose a patient presents with the pain and tenderness in lower part of neck, just above the clavicle. The pain worsens when the patient swallows or turns their head. So the patient's symptoms suggest a potential issue within the digastric triangle of the neck. So what should be the so here several structures could be involved. Number one, there could be inflamed submandibular salivary glands. The salivary glands, as we know, submandibular salivary glands, they are located within the digastric triangle. So inflammation of this gland would cause infection or blockage of the salivary ducts that could lead to pain, tenderness, swelling in the lower part of the neck. The pain may worsen during swallowing due to movement of the surrounding structures. Second, it could be due to the submandibular abscess, due to the causes due to the infection within the submandibular salivary glands, or its ducts could lead to formation of abscess. So this abscess can cause pain, swelling, tenderness. Third, there could be swollen lymph nodes. Enlarged lymph nodes within the submandibular glands can cause infection. and may contribute to pain and tenderness. Tenderness, or the other reason could be tenderness and discomfort could be related to the muscular or soft tissue problems within the digastric triangle. For example, there could be strain or inflammation of muscles like the digastric or mylohyoid muscles that could lead to these symptoms. Now let us discuss the role of mylohyoid muscle in the digastric triangle. The mylohyoid muscle, as we know, it contributes to the floor of the digastric triangle. That is also known as submandibular triangle. The triangle, it is bounded by two bellies of digastric, anterior belly and the posterior belly. The mylohyoid muscle, it will form the floor of mouth and is closely related to the submandibular salivary glands. So the attachment of the mylohyoid muscles is more inferiorly in the anterior region and more superiorly in the posterior region. So suppose this one is the tooth, caries tooth. The infection from the lower molars could easily spread below the mylohyoid line and into the submandibular space. So that is only the point that you have to remember for your clinical point of view. Now another point to remember is, while getting approach to the digastric triangle, you have to you give a submandibular incision to assess the triangle. So but here lies the submandibular incision. It is a surgical approach that is used to assess structure within the digastric triangle. So remember, the incision should be made inferior to the marginal mandibular nerve. So this nerve is a branch of facial nerve that supplies the muscle of lower lip and the chin. So while performing a submandibular incision, the surgeon aims to avoid damaging this nerve to prevent the potential cosmetic and functional issue such as lower lip drooping or weakness. So incision a 2-finger breadth below the inferior border of mandible would provide a safer access to the submandibular triangle than the 2 centimeter line below the inferior border of mandible, in order to avoid injury to marginal mandibular branch of the facial nerve. So that is important and asked many a times in the entrance exam. The next is the carotid triangle. The carotid triangle, it is one of the subdivision of the anterior triangle of neck that contains the important anatomical structures including the carotid arteries and the nerves. So what are the boundaries of the carotid triangle? Superiorly you will see the posterior belly of digastric. Anteriorly is the superior belly of the omohyoid muscle, and posteriorly is the anterior border of the sternocleidomastoid muscle. The roof of triangle is formed by the skin, superficial fascia that contains the platysma muscle, the cervical branch of the facial nerve, ascending branch of the transverse or the cutaneous nerve of the neck, the deep fascia that enclose the submandibular salivary glands. The floor of the triangle. It is formed by the mylohyoid muscle anteriorly, the hyoglossus muscle posteriorly, and small portion of middle constrictor muscle of the pharynx. Now what are the contents? It contains the arteries. The arteries are the common carotid artery, with the carotid sinus and carotid body. The internal carotid artery and the external carotid artery, which are the branches of the common carotid artery. The veins are the internal jugular vein. The nerves are the vagus nerve, superior laryngeal branch of the vagus, dividing into the external and internal laryngeal nerve. The spinal accessory nerve, hypoglossal nerve. The lymph nodes associated are the deep cervical lymph nodes. Now what is carotid body? So you can see here, this structure is the carotid body. So this structure marked in white is the carotid body. So this is, you can see a small oval structure. So this is a small oval structure behind the common carotid artery bifurcation. So the here acting as a, so it act as a chemoreceptor. So main function of it is to act as a chemoreceptor to respond to the blood oxygen, carbon dioxide and the pH level. So it detects the changes in composition of blood passing through it, mainly partial pressure of oxygen. It is also sensitive to changes in pH and temperature. So it is present near the bifurcation of the common carotid artery. The other important structure is the carotid sinus. So what is carotid sinus? The carotid sinus, it is a specialized area that is located within the internal carotid artery. At the bifurcation into the common carotid artery, and the internal carotid artery. So what is its role? Its role is regulating the blood pressure and it is involved in the body baroreceptor reflex. So the carotid sinus, it is a dilated area located at the base of the internal carotid artery, near its origin from the common carotid artery. So it is situated at the level of carotid bifurcation, that is typically at the upper border of the thyroid cartilage. So what is the function of this carotid sinus? It contains specialized nerve endings that are known as baroreceptors. So these baroreceptors are sensitive to changes in the blood pressure. So when the blood pressure would increase, the carotid sinus would stretch, and the baroreceptor, they would be stimulated. So when the BP decreases, the carotid sinus relax, reducing the stimulation of baroreceptor. So this baroreceptor reflex, it is a critical mechanism for regulating the blood pressure and maintaining the cardiovascular homeostasis. So when the baroreceptor in the carotid sinus detect an increase in blood pressure, what they will do, they will send a signal to the brainstem, specifically to the medulla oblongata. So that will trigger a series of autonomous response that will cause reducing the blood pressure and including the parasympathetic activation that stimulates the vagus nerve, leading to decrease in the heart rate and vasodilation, or sympathetic inhibition, that is the inhibition of this sympathetic nervous system, leading to decreased vasoconstriction and reduced heart rate. So if the baroreceptor detects a decrease in blood pressure, the opposite response occurs. So this reflex helps to stabilize the blood pressure level in response to change in the posture, physical activity or other factors. Though what is the clinical importance of this carotid sinus? The carotid sinus is innervated by nerves. So in some individuals, this sinus can be overly sensitive. So in cases like the sudden head rotation might lead to slowing of the heart rate. So that condition is known as carotid sinus syndrome. The carotid sinus massage can help to control the supraventricular tachycardia. Also, it is advisable not to tie neckties too tightly. Necktie can potentially compress both the internal carotid artery. In some patients, a carotid sinus massage may be performed to stimulate the baroreceptor reflex and helps to terminate the certain type of supraventricular tachycardias, that is abnormally fast heartbeat rhythm. Now let us discuss the clinical anatomy of in case with the carotid triangle. Suppose a patient came to the emergency room with sudden onset dizziness, difficult speaking and weakness on one side of the body. The patient family reports that the symptom appeared suddenly while the patient was eating dinner. The patient is having trouble swallowing and seems confused. So these symptoms suggest a potential issue with the carotid triangle of the neck, particularly involving the blood vessels and nerves that pass through this region. So what could be the possible explanation that can be considered? Number one is the carotid artery dissection. The carotid artery dissection is a tear in the inner layer of the carotid artery wall. So that can cause formation of blood clot that partially or completely blocks the blood flow to the brain. So the patient would feel like sudden dizziness, difficult speaking, weakness on one side of body and confusion. These are indicative of potential stroke resulting from the reduced blood flow to the brain. Second is carotid artery embolism. An embolism occurs when a blood clot or debris travel from another part of body and blocks a blood vessel. If an embolism lodges in the one of the branches of the carotid artery, that can lead to stroke-like symptoms. Third, there could be transemic ischemic attack or the mini stroke due to the blockage of blood flow to the brain. It can cause similar symptoms as stroke, but it resolves within a short period. Last could be the carotid artery stenosis. The carotid artery stenosis occurs when the carotid artery narrows due to buildup of plaque. So if the blood flow becomes significantly restricted, that can lead to the stroke. Next and the last triangle is the muscular triangle. The boundaries anteriorly, there is midline of neck. Superiorly, there is hyoid bone. Inferiorly, there is sternum. Inferior posteriorly, anterior margin of the sternocleidomastoid muscle, and posterior superiorly is the superior belly of the omohyoid muscle. So the contents, the muscles involved are sternohyoid, sternothyroid, omohyoid, thyroid. The arteries, superior thyroid artery. The veins is anterior jugular vein, and the nerve associated is the ansa cervicalis. The content, the lymph nodes are the anterior cervical, infrahyoid, prelaryngeal, thyroid. These are the lymph nodes that could be associated. So remember, these infrahyoid muscles, they are organized in two layers, superficial and the deep layer. The superficial is the sternohyoid and omohyoid, while the deep is the sternothyroid and thyroid. They receive their nerve supply from the ventral rami of the first, second and the third cervical spinal nerves. So what should be the clinical anatomy? Suppose a patient present with a feeling of tightness and discomfort in the front of the neck, particularly while the swallowing. The patient reports a hoarse voice and difficult breathing when lying flat. So, on examination, you see that the thyroid gland is enlarged. So, the patient's symptoms suggest of potential issue within the muscular triangle of the neck, specifically related to the thyroid gland. So, what could be the possible explanation for the reason? There could be enlarged thyroid gland, like in case of goiter. Patient may feel tightness and discomfort around the front of neck. So this enlargement can compress the nearby structures including trachea and the larynx. So that would cause the hoarseness of voice and difficult swelling. There could be presence of thyroid nodule, that is lump or growth within the thyroid gland, that can cause tightness in the chest. The third is the thyroiditis, that is the inflammation of the thyroid gland, that can cause pain, swelling and discomfort in the neck. Along with that, you could see hoarseness, swallowing, difficulty in swallowing and discomfort. Other abnormal thyroid hormones level due to overactive thyroid, that is hyperthyroidism, or underactive thyroid, that is hypothyroidism, that could lead to symptoms like voice changes, swallowing and discomfort. Other things that you have to remember is that tracheostomy and thyroidectomy, they are the invasive surgery that assess this triangle. The skin incision should be made parallel to Langer line, and during thyroidectomy, injury of the superior thyroid artery can result in bleeding during the surgery. So this was all about the anterior triangle of the neck.